Okay, let's unpack this. Imagine trying to understand something incredibly important for public health, but, well, no one can quite agree on what it actually is.
A classic challenge.
Right. And today, we're cutting through that noise. We want to show you how one group, the Canadian Initiative on Frailty and Aging, or CIFA, tackled an almost impossible task.
Bringing clarity to frailty in older persons. A vital concept, but so vague, scientifically speaking.
Exactly. And their approach, it offers this powerful blueprint, really, for how any complex, multidisciplinary problem can be untangled.
We're diving into their methodology for systematic reviews, truly a masterclass. And when we say systematic reviews, we mean this super organized, really rigorous way to find and synthesize all the relevant research, leaving no stone unturned.
So you're going to need a shortcut here, not just to understanding frailty, but how experts bring clarity when you're faced with just information overload, in any field, really.
And frailty, as our sources really stress, it has a huge impact on individuals, obviously, but also their families, especially caregivers.
In the healthcare system, society as a whole, we sort of intuitively get that it's serious.
We do, but pinning it down scientifically, that's been remarkably difficult.
Yeah, that's the core problem, isn't it? Despite, what, 2 decades of research?
Substantial research, yeah. But still no consensus on a precise definition or even how to consistently identify it.
Which must create massive hurdles for research, for actually helping people.
Absolutely. It's hard to compare studies or develop interventions if everyone's using a different ruler, essentially.
So, okay, CIFA forms back in 2002, facing this huge problem. What did they actually do? How did they start?
Well, they knew they needed an innovative methodology right from the start. A key step was setting up a central coordination group, the CCG.
The methodological backbone, you called it.
Pretty much. They developed, refined, supported all the processes, kept things consistent, and they worked with question leaders, experts in the 10 specific research areas CIFA was exploring.
In areas like biological basis, social basis, prevention.
Exactly. Prevalence, risk factors, impact, identification, environment and technology, health services, policy, the whole gamut.
Okay, now here's something that really jumped out at me. Their search strategy. You mentioned no universal definition.
Right. So they couldn't just search for frailty. They had to be incredibly inclusive.
How inclusive?
They used broad core keywords like aged and combined that with a whole list, frailty, obviously, but also vulnerable, vulnerability, successful aging, healthy aging.
Even disability or disabled persons.
Yes. They cast this incredibly wide net just to make sure they didn't accidentally miss relevant studies simply because the terminology was different.
Which makes sense, but then how do you avoid bias creeping in, especially when the concept itself is so, well, fuzzy?
Good question. That's where the rigorous blinding process came in.
Ah, blinding. Tell us about that.
So abstracts first, then the full articles were reviewed by 2 independent question leaders.
Okay.
And these reviewers were kept completely in the dark about who wrote the paper, which journal it was in, who funded it.
So decisions were based purely on the content, its relevance.
Exactly. Not swayed by big names or prestigious journals. It aimed for real objectivity.
Okay, so they've got this mountain of papers, all potentially relevant. How did they compare them meaningfully if the definitions were all over the place?
That was the next clever step. They developed their own classification system, a unique one, with 5 categories based on how the authors themselves defined frailty in their studies.
What were the categories, roughly?
Things like, did the authors see frailty as a physiological syndrome, or maybe a complex syndrome, geriatric syndrome, or was it more aligned with disability?
And the 5th.
Or was it simply defined by the setting or source of recruitment, like frail patients from Clinic X?
Ah, I see. So grouping studies by how they conceptualize frailty. That's smart. It imposes some order.
Precisely. It allowed them to compare apples with, well, maybe slightly different kinds of apples instead of apples and oranges.
Makes sense. Okay, what about quality? Not all research is created equal.
Definitely not. And they couldn't just use a standard quality checklist because the studies were so diverse. You had cohort studies, cross-sectional ones, randomized controlled trials.
Different designs needing different ways to assess quality.
Exactly. So they had to adapt existing tools or in some cases design completely new ones specifically for this project.
Wow. And how did that work?
Again, 2 assessors working independently. They rate various items in each article and give an overall quality score, usually on a 1 to 4 scale. Then they'd meet to discuss any disagreements and reach a consensus.
That sounds thorough.
Very. And then to synthesize everything, they used a system of grades of evidence. Think of it like a summary code.
A code.
Like, you might see a 4B. The 4 would tell you the methodological quality was very good, top-notch. And the B might indicate clear evidence of, say, a negative association or outcome.
So at a glance, you get the quality and the finding. A neat way to summarize a huge amount of varied work.
A really powerful tool for making sense of it all.
But this whole process, it wasn't exactly smooth sailing, was it? What were the main challenges?
Oh, definitely challenges. The biggest one, conceptually, was just deciding what counted as frailty literature to begin with.
Right, back to the definition problem.
Exactly. Their solution, as we said, was that radical inclusivity up front, rather than getting stuck debating competing viewpoints before they even started.
A pragmatic choice.
It had to be. Then there was the constant balancing act, keeping the methodology consistent across all 10 areas.
While still allowing enough flexibility for different disciplinary approaches.
Precisely. So, for instance, some question leaders were allowed to narrow their final reviews down to maybe 1 or 2 key frailty definitions that were most relevant to their specific question. Or they could include really important seminal papers even if they fell slightly outside the strict time frame.
That makes sense. It sounds incredibly labor-intensive, though.
Hugely. The reviews took much longer than expected. Just developing the methodology involved lengthy discussions and that quality assessment we talked about.
The 2 assessors reaching consensus.
Yeah, that could take anywhere from 30 minutes to, get this, 2.5 hours per article, per assessor.
Wow. That really puts the scale of this into perspective.
It does. But one of the most striking findings, or maybe revelations from the whole process, was just how much variation there was in definitions and measurements, even within a single research area. It really highlighted that researchers essentially were not speaking a common language.
Like the elephant analogy, everyone describing a different part.
Exactly like that. You can't get a picture of the whole elephant if everyone's using different terms for the trunk, the leg, the tail.
But seeing that variation laid out so clearly must have been valuable in itself.
Immensely. It underscored the need and actually the potential for evidence-based convergence on a definition, moving towards that common language.
So despite the challenges, the initiative was a success.
Absolutely. It fostered crucial interdisciplinary collaboration, built a more integrated understanding of health and aging, and really flagged the need for better methods for these big, complex, multidisciplinary reviews.
So if we connect this back to the bigger picture, CIFA's work, it wasn't just about frailty, was it?
Not at all. It was, in many ways, a blueprint, a model for how we can approach other complex health questions, especially where definitions are still evolving or contested.
Bring different fields together.
Fostering that vital dialogue. And highlighting that we need more sophisticated tools, more refined methodologies for doing these kinds of large-scale systematic reviews effectively.
So what does this all mean for you listening? It shows that a structured approach, but one that's also flexible, can lead to incredible breakthroughs, even with a concept as tricky, as multifaceted as frailty.
It really can drive collaboration and new insights.
Which leaves us with a thought. What other vital areas of knowledge, areas that feel ill-defined or where experts don't quite agree, could benefit from this kind of rigorous yet adaptable interdisciplinary deep dive? And, what surprising clarity might emerge if we really embrace that methodological flexibility?